It is, the full form is National Institute of Health Stroke Scale. Okay, this was actually developed when they did the trial for Nihss RTPA. It was called as Nihss RTPA trial, National Institute of Neurological Diseases TPA trial. At that time, they did this NIHSS scoring. Now, we all need a unified scoring system that if you want to communicate. For example, when you have traumatic brain injury, we communicate saying there is GCS. You know, we talk about the GCS. We talk the GCS is 8 by 15, it's 9 by 15, it's 10 by 15. We can't use that when it comes to stroke scales. The GCS score is specifically made for traumatic brain injuries. So when you have TBI, it makes sense. The GCS is 9 by 15, 10 by 15. But when it comes to stroke, you can't use the GCS. So it's very funny if you have on your notes a GCS, you can put it. But it is not something that is corroborating. समझ में आ रहा है? In these scales, that's why when you have stroke, we normally talk about NIHSS. When you are diagnosing the stroke on ED and sending them to the whether you have to be in the ED or out of the hospital, you do a ABCD score where age, blood pressure, clinical features, duration and diabetes comes in. Right? And we discussed that if the score is less than 3, the stroke risk is less than 1%, 0.4 to 0.8%. So you may not need to do this on an urgent basis of admission. You can do it on an OPD basis where you can do the scan, in OPD basis, an MRI on OPD basis, things like that you can do. Evaluation on an OPD basis, you don't need to admit. The NIHSS comes in when you have diagnosed that there is a stroke in place, and then you have a unified criteria to say this is the NIHSS score. Now, why is this developed? So there are a lot of caveats when it comes to NIHSS score. For example, what would you do with the NIHSS score? It gives you the severity of stroke. It tells you how severe the stroke is in the first place. So you now speak the same language. NIHSS is 8, NIHSS is 8, NIHSS is 8. First of all, you speak the same language when you are giving an over. That the NIHSS 8 or 9 or 10, what do we give that over? Second thing, what we understood was that if the NIHSS is more than 22, above 22, if NIHSS was above 22, the chances of hemorrhagic conversion, were higher. That means when you thrombolize your patient with an NIHSS score of more than 22, the chances of hemorrhagic conversion is higher. Okay, this was what was there. This should not deter you. This should not deter you from actually thrombolizing the patient. It should not deter you from thrombolizing the patient, but you should understand that on the higher levels, there is a chance of hemorrhagic transformation. Of course, it's a clinical score. For example, the caveat comes over here is, say you have a previous stroke. The NIHSS becomes very difficult to do. Are you getting the point? If you have a previous stroke and one hand is personally not moving and now develops a repeat stroke after 3 months, within 3 months you don't want to thrombolize. But now patient had a stroke 4 years ago, left side was not working and now right side stops working. Your NIHSS score will be very high. Are you understanding? Your NIHSS will be very high. That shouldn't stop you from thrombolizing your patient. Similarly, a patient who's come in with dysphagia, cannot talk, half of the NIHSS score you can't use. If the patient has got dysphagia and dysarthria, that means he can't talk, he cannot articulate, half of the NIHSS score you can't use. Do you understand? Then again the score becomes very high. But that doesn't mean you are not going to thrombolize that patient. समझ में आ रहा है? Are you getting the point what I'm saying? Because in NIHSS score you have language, speech, orientation, you have got so many things. Now, if the patient is not oriented and cannot talk, तो तुम्हारा NIHSS score तो आधा तो will be very high. You understanding? So then you will say, "Arey, 24 हो गया, let us not thrombolize." It doesn't work like that. That's why clinical judgment supersedes everything. Are you understanding the point? But we do know that the NIHSS score is very low. So if it is less than 4, and the patient is going to slightly improve, the chances of TPA doing anything here is unlikely. TPA helping this patient to improve his overall outcome, because the outcome is already good. It's not very bad. So TPA doing anything in this, so you could call it this way, that the NIHSS score is very low. There is really no point of starting TPA, especially because the outcomes may not change only. The outcomes are going to remain the same. Are you understanding how do you use the NIHSS score? So there are multiple scores when it comes to stroke. You have LAPSS score, Cincinnati score, you have the ABCD score, you have so many scores that are in place. But what has been unified, used after the stroke is NIHSS. So it is a crime if you don't repeat your NHS score inside the hospital. But if you, the other way to use the NHS is also say you are on rounds. Your NHS was 8 and now it has worsened by 2 points. Okay, you are on rounds, it has worsened by 2 points during your thrombolysis. So you had a thrombolysis going on. Okay, and it has worsened by 2 points. This is something that you need to figure out what is happening. Okay, and there will be many things what will be happening at this point, but it gives you a number saying, okay, it has worsened by 2, so now you evaluate what is happening wrong. You understand? So you understand how to use the NIHSS? It doesn't take more than 3 to 4 minutes to do the NIHSS. You don't need to remember all the entities. It is language, speak, dysarthria, consciousness, extinction, limb power, this side, upper limb, lower limb, that all comes in that. Okay, and it is very difficult to do it if you ask me, if the patient has some previous stroke. It's got a lot of caveat when it comes to previous stroke. It becomes very, very difficult. If a person does not have a limb, again it becomes difficult. Amputation अगर हुआ है तो कुछ मतलब ही नहीं होता, ऐसा हो जाता है. समझ में आ रहा है? So the NHS score have to be taken care of and done properly. And unless you do it on a regular basis, you will never get the hang of it. Okay, it is also developed in a way. It is also developed in a way that it can be done by the nurse. It can be done by the doctor. It doesn't need a medical doctor to do the NHS score. It can be done by a nurse, it can be done by a doctor, it can be done by a healthcare worker that is present at that particular moment. You got the point? Any questions on the NHS score?
Sir, is it not very subjective?
Very subjective. That is why we have to be clinically relevant.
There is change of 2 to 3 points. Then
so it's not as subjective as you think. It's not as subjective as you think. There are a lot of things that are there in that. Okay, and when it changes the points, very clearly it is mentioned how it changes the points. Okay, it's not as subjective. They are trying to make it as objective as possible. But when you are giving your over, so don't just say NIHSS was 8, it has become 10. You don't give an over like that. What you give an over is, you write down in your file, this patient was unable to move his extremity, now is able to move his extremity. Initially he was able to move it against resistance, now he is not able to move it against resistance. You have to write the point which actually tells the difference of neurological condition that has occurred. You don't write NIHS 7 has become to 9. You have to write it. What has made it 9? You understand? That is very important because that is what you are going to follow up. Clear? Clear how to use the NIHS?
So, like you said in amputations, and how do you number that?
So very difficult. Very difficult. So there are caveats for everything. So when you read it in detail, then there is a difference that you have to do. If there is amputation, how much you have to score it is written. So you don't need to. The easiest thing is to open up an app. Okay, the NHS is there on so many websites with apps. So you just each of these apps you just say yes, no, yes, no, yes, no, and you get an answer at the end. It's always better to do it with an app. Okay, there are so many apps that are there now which will give you the NHS score, and it tells you that if the patient is this, then do this. It tells you then do this. Got the point? So the NHS has to be used very, very carefully. It's very important. Okay.